Welcome back to Get Your Man On. This is Evan Bass. We are here with Justin Turner, men's sexual health expert extraordinaire in erectile dysfunction, low testosterone, testosterone replacement therapy, treated 20,000 men. Justin, I got to ask, testosterone, when you first think about it, I think a lot of people think of like bodybuilding. They think of Arnold Schwarzenegger. They think of, body lifting competitions. You tell someone, hey, testosterone replacement therapy, and they just think I'm trying to, get massive or something. What's the difference between like bodybuilding testosterone connotation versus like what you do?
Yeah, I mean, the difference is the goal. Our goal with guys in our clinics are to replace the deficiency and then inspire them to lead healthy lives and, reap the benefits of that. With bodybuilders, they're trying to do things unnatural. They're trying to inject massive amounts and get to massive levels to really take advantage of the androgen effects of testosterone and build a lot of muscle and look like, those cartoon characters. And so the actual medication isn't different in some cases. They use other things also. But the medication itself, it's really about the amount and frequency and just where they take it. We're trying to get guys to normal levels, and then get them to do the rest, do the work. And they're really trying to get the drugs to do all the work, which increases the consequences. We also run a very tight follow-up, medically supervised program where we're drawing blood initially 6 weeks out every 3 months. Some of those guys, they could care less what their blood shows. They only care what they look like in the mirror after they did some deadlifts, And so it's not the same thing by any stretch of the imagination. We're trying to get a guy to a level of 600-700, and they're trying to go to 2,000.
There's got to be side effects for that kind of stuff.
There absolutely are. There's side effects for testosterone replacement, even when you're doing it responsibly. You can see acne, swelling in the ankles. You can stimulate the prostate, which causes some urinary things. There's some risk with cancers, prostate cancer, increased cardiovascular effects. I mean, you most definitely can have side effects when it's done correctly under medical supervision. When you do it at the gym level, hate to pick on gyms because a lot of us should be in a gym, but but at that level without supervision, the most side effects we believe are associated with the actual level of testosterone in the body. And so, yeah, they're going to see more side effects for sure. They also throw off other hormones, estrogen being another example. They try to eliminate that from the body completely. Which is going to increase cardiovascular risk for sure. And so some of the consequences of what they do is actually effects on other hormones in the body that they're not balancing.
Wow. So do guys need estrogen?
Oh, absolutely. Yeah. For a long time, we weren't very clear on that, but we are now. It has something to do with sexual function and desire in guys for sure. But the biggest risk is cardiovascular. Women's heart attack risk compared to men's a lot lower before menopause. It's a lot closer to being equal after menopause, and that's simply because of estrogen and how it protects their heart.
So estrogen's like a mother taking care of us.
Absolutely. Absolutely need it for sure.
Definitely need it.
Yeah, and so in some cases, one of the side effects of testosterone is too much conversion to estrogen. I see that in my guys that carry too much adipose tissue, bigger guys. And so we will step in.
Fat?
Fat, I do mean fat. We will step in and block it when we need to, but never with the goal of driving it to zero.
Gotcha. And so is that like where man boobs come from?
Yep, absolutely, yeah. You increase too much conversion to estrogen, and that is a risk that you most definitely could have, again, at a pretty high level. Not a very common thing we see, but is a risk if you go too far with it.
Gotcha. Is it true that fat produces estrogen?
Absolutely, yeah.
Huh. And so fat can actually make us have too much. You can have too much estrogen, and then that can cause the man boobs. Mm-hmm. So you're saying with proper testosterone replacement therapy and potentially blocking some of that estrogen, you can change how you look if you've got those things?
So yes, you can most definitely slow down the progression of it. I would say that. Sometimes it's hard to do, once we get so much deposit there, sometimes they, rapid or not rapid, but it takes a lot of weight loss and maybe even some surgical interventions at some points if it goes too far.
Gotcha. But typically, could you just get really serious about your diet, serious about working out and all that stuff and see improvement?
Yeah, absolutely.
Gotcha. Okay. All right. That's awesome. What age do most guys start seeing low testosterone?
Yeah, so that's becoming younger and younger. So, I mean, normally about 30, we start to see a decrease about 1% a year. We consider that to be normal. The pituitary gland just simply stops sending as many signals to the testicles, and so they don't produce as much testosterone. You also see sex binding hormone increase as we age, and so losing testosterone at a slow gradient of 1% a year is pretty normal. And we used to say 40, now we say 30, right? So we are seeing it happen at a younger age. As far as when do guys get full-blown low testosterone, where they become symptomatic, again, that can happen at all different ages. The number one cause of low testosterone is primary, where the testicles fell. And so you're going to see a higher number of that of guys who are older, but you can see it in a 25-year-old. You can see it in a 35-year-old. Most definitely becoming more common.
I saw a study that said where a urologist had done a look at testosterone in men, and he made the recommendation that men should start getting annual testing for testosterone at the age of 18. Would you agree with that?
I absolutely would. I shared with you earlier that we've done a really poor job. Like, my job would be a lot easier trying to figure out where a guy's going to be therapeutic if I knew where he was at 18, at 28, at 38, and now at 48 where he should be. Because I think it's very clear that some of us run higher lifelong levels of testosterone and some of us run lower. And so knowing that would be great. It allows us to treat people as individuals versus kind of these guidelines when things change. And so I'm most definitely a fan. The slippery slope is you check a guy who is 20, it's great to have that number, but what if he's not symptomatic? Like, what if he feels amazing? Then you get into that spot of do you treat or not treat type of deal. So that's really about the only negative, but I'm all for checking guys.
Do you think, because I've heard some guys that say, I feel fine. And you check them, they're low, and he's like, yeah, maybe I'm a little energy. And then they take it, and they're like, oh my gosh, I had no idea. Do you think that has anything to do with it, that they're just used to living in mediocrity?
Yeah, absolutely. I've heard you have some of those conversations with those guys and pull them out. The decreased energy. There are generations just have really good work ethic. They're going to put one foot in front of the other no matter what their testosterone levels are. Newer generations, it's a little different nowadays, and we are a little quicker to complain and whine in how we go about it. It's also not universal. The decreased desire to have sex, like we relate that to low testosterone. It's a very common thing that guys report, but not all guys with low testosterone complain of decreased libido. But I've seen exactly what you're describing. Guys who think they feel okay, they choose after being educated and weighing out the benefits and risks to do the testosterone, and then they really realize that they didn't feel okay. So I've seen it play out that way also.
Gotcha. And you mentioned, the blood test, having the blood test. I mean, and then so are there any other indicators of low testosterone other than the blood test and maybe the side effects? Anything else that you might, the side effects of low T? Any small hidden things or little gems, or is it pretty simple, straightforward?
It's pretty straightforward. Again, we use pretty smart questionnaires that were written by really smart psychiatrists through the years. And they're pretty pointed questions, and you get 3 or 4 of those, and the likelihood of having low testosterone most definitely goes up. Weight gain and decrease muscle mass. I mean, there are guys where that's a significant, they're just losing muscle mass. We also find it when guys break a leg, not abnormal, but then next year they break a hip, and we all see osteoporosis, and we go looking for a cause, and we find that they have low testosterone there. So it's an additive, multiple symptoms along with the evaluation and the history and then the blood test. You need that complete picture to accurately diagnose it and treat someone.
Gotcha. At what age would you feel comfortable? You're not going to treat a 15-year-old, right? At what age would you feel comfortable treating a testosterone patient?
Yeah, I'm personally not going to treat a 15-year-old because that's not my specialty. If we happen to identify it, you're going to want to put them in front of a pediatric specialist because there are going to be complications for that young man if he continues to be deficient. He's not going to progress through puberty correctly. So they're just as important. The answer to treating a young guy versus an older guy is all about fertility. Really, the only difference in consequence, in my opinion, is when you do testosterone therapy, it does suppress fertility, can lower fertility. So for an older guy who has 2 or 3 kids, probably not looking for any more, way less of a consequence. For a guy who's younger and hasn't had children, that can have a greater consequence. So the fertility, like where are they at in life with children? What can we do to plan to make sure we maintain that? That's kind of the difference there. But I don't have a set age of where I'm going to tell a guy, hey, you're just too young. We used to do that all the time. I'm not going to do that now.
Wow. So that you've changed.
We all have. I believe all the guys who are current on their knowledge and research and where this is going, we've all changed.
Man.
Been exciting 10 years.
We're going to talk more about this. Coming up, testosterone. How do you treat it? What specific kinds of things can you do to treat it? With Justin Turner. Go to getyourmanon.com to ask questions. Click the button. We'll be back.